Soune Jai Shri Krishna, Jai Jinendra, Jai Swami Narayan, Sairam. Good evening to you all, and well, a very warm welcome on today's health and well-being session. We're so glad you could join us for this important discussion on a topic that affects so many in our communities: medication for type 2 diabetes, chest pain, and heart failure. Let's invite uh, Uttambai. Uttambai, all
Thank you very
yours.
much. Can you hear me?
Yes, we can.
Fine. Okay, thanks very much uh, for this opportunity. So last week we talked about heart failure. Sorry, we talked about blood pressure. Any thoughts, any reflections on it before we move on? Anybody?
I would like to ask, because I heard you talk about sort of adverse effects from some of the medication that we use for high blood pressure. And I have had a dry cough for donkey's years. I've been to the surgery many times asking for something for it. I've never got anything. And then last week, I heard you say that the medication I use, one of the side effects is dry coughs. Now, I was wondering whether you would be able to suggest which medications I should be asking for.
Well, it depends. It depends which medication you're taking. As one of your colleagues mentioned one of the old participants mentioned she had a dry cough with amlodipine, and it depends
Yeah, that's
which
the
one.
one.
So again, taking her scenario, you can approach your GP and try a different one, a different group from the same a different agent from the same group.
But you as a pharmacist, could you recommend one or two that I should be researching?
I I can talk to you about afterwards, but not
All
now.
right.
Okay.
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 Thank you.
Fine. Anything else?
Yes, please. I missed the last session. Do you have it on YouTube, the last session about about the blood pressure? I didn't know. I wasn't aware of it. I would love to hear about it.
It has been recorded, but we haven't had time to put it on YouTube. So just bear with us and give some time, and we'll put it on.
So
Thank
how
you.
will I find it? You'll give it to Money Mystery?
No, once it's online, then we'll notify that it is on in our WhatsApp messages.
So what's your WhatsApp messages? I got through somebody who had given us this. So what WhatsApp message? I'm not in the group probably.
Okay, you see my number there on the screen. Can you take it down and message me, and I'll help you out? Yeah.
Okay, thank you
Thank
very
you.
much. Thank you, Panna.
Okay, so
Anybody else?
I'm just going to something has been published this week which may be of interest to you regarding blood pressure, and just to demonstrate the scale of the problem there is. So I'm just going to put this down, and I'm going to share my screen with you. Let's see whether you can see that. Can you see that?
No, can you share it? Because I had to stop when
Okay.
somebody was talking.
So
Doris,
how do I share that?
how you logged in just now?
Okay, so I can see you.
That's it, yeah.
Okay, so you can see me now. Okay, so you can see this. This has just been published. I don't know if you can you see it?
Yes, we can.
Yeah. So it
Can
is
you make it large? Take off
uh,
the side bits. No, take the side bits out. Yeah.
I don't know whether I can. So, but anyway, you can see this the blood pressure on the top up here in the circle is one of the highest incidences everywhere in the world. Just not in UK, but everywhere in the world. You see, it's quite high up, and and cholesterol that we're going to talk about today, and the diabetes that we are going to talk about today. You see, and and big people who are very big in size, does contribute to the problem, you see. So it's quite a big problem actually everywhere in the world. Yeah, so that's been published only this week. Okay, so let me just go back to my presentation. Okay, there it is. Can you see that?
Yes.
Okay, so I have no conflict of interest to declare because I'm dealing with medication. So I have to be pretty upfront with you that I'm not getting paid by any pharmaceutical companies. I'm doing this on my own accord. And I'd like to thank GAA again for giving me this platform to discuss this topic. So today we are going to talk about heart attack, type 2 diabetes, and heart failure, and all the medicines that goes along with it, side effects, and what to do when you are unwell. So let's talk about heart attacks. Um, if I give you a scenario with an analogy of an heart attack. So if you look at these central heating pipes, when you install central heating pipes in your home, when the pipes are new, completely, if you look inside it, they are all clean and fine, aren't they? But look at it 20 years down the line, then you see what's happening inside the pipe. As I'm sure many people will have seen the pipe of the central heating pipe after 20 years. And unfortunately, the same thing tends to happen in our coronary arteries as well, you see. So when we are born, our arteries are quite clean, yeah, very clean. And as we get older and older and older, the cholesterol tends to build up inside the wall of the arteries, you see. Yeah. And there comes a time when the blood can't flow very well at all because of the blockages of the cholesterol and some other ingredients of the blood as well is called platelets. So the blood tends to stop, you see. And when the blood tends to stop, that's when you get your heart attack, you see, because the muscles is not getting the blood supply. So that's what heart attack is. So along with again, in your central heating scenario, um, when the pipes are completely blocked, the radiators don't warm up. And if the radiators don't warm up, the room doesn't warm up. So you're feeling cold, you see. And the same thing happens in a heart attack, you see. The blood doesn't flow to a specific part of the heart, and the muscle that is supplied by the blood vessels slowly tend to die, you see. So that's what a heart attack is, you see. So when you get a heart attack, um, some people can be completely asymptomatic, mainly some diabetic patients. Some people get quite severe pains, chest pains, pains in the back. It can be quite severe, like severe indigestion pains. Some people will get pains along the neck, inside their arms, and those kind of things can happen, you see. And when that happens, you have to be rushed into the hospital, you see. And at that stage, when you get into the A&E department, they will do the basic ECGs, ask you all the questions, get a clinical history, and they'll make a diagnosis, you see, from those things, you see, that you describe to them. Yeah. And one of the things that they will actually do is total cholesterol as well, you see, as to see what's happening. And one of the markers of problems in total cholesterol is this low density lipoprotein, is LDL. That's the bad cholesterol, and the high density lipoprotein is the good cholesterol. So you want LDL to be very low and HDL to be quite high, you see. Okay. So once you have had the heart attack, what they will do is that they will, depends which hospital you're in, where the facilities are there within the hospital, they will probably put a stent in, which basically involves putting a wire through your arm up into the coronary artery and just blowing it up, you see, and they keep that blocked arteries open, you see, and they want to keep that open all the time, and then the blood starts flowing, and the muscles that were affected hopefully should recover. So that is the essence, and that what stents mean, you see. So, and that is now commonly done, you see. And in the past, stents were not available. So they used to give injections to break the clot up, you see. But things have moved on now. So hopefully you'll be getting a stent if you get a heart attack. So once you have had your heart attack, we need to prevent you getting another one. And that's the most important thing, to prevent getting another heart attack and the consequences of the heart attack. So in order to prevent that, you will be given some medication, and the medication will be some aspirin-like medication, tablets to lower your cholesterol. Even if you're already taking it, if you're already taking your cholesterol tablets, they will increase that to get the maximum benefit. If you are a smoker, they will advise you to stop smoking. That's a must, and they will encourage you to get exercises. There will be some training exercises for you, see, and they look at all your risk factors, including blood pressure, diabetes, and all those things, you see. So as and then they need to prevent you getting that further heart attack, you see. So again, the lifestyle issues that we have mentioned in the whole series of this particular webinars that has been taking place: stop smoking, have a healthy diet, regular exercise, healthy weight, also your well-being, you see. So all those things will be encouraged, to see. Um, and we'll talk about the drugs in a minute, but making sure that you're getting the drugs, both the aspirin type drugs, tablets to lower your cholesterol, and if you're of a certain age, then if you're due for any immunization, like all the vaccines, you should take it up, because it will prevent you getting the complications as well, you see. So you should take the vaccination up. The reason being, it prevents all the long-term complications of the diseases, you see. And
Uttambai, can I ask a question?
yeah,
So we've done this far, we've gone so far. So what are the most commonly prescribed medications for type 2
I
diabetes,
will
chest pains, and heart failures?
I will come to that in a minute. Yeah,
Okay.
and they are very similar to the ones that we discussed last week as well, you see. Yeah, extremely. For the blood pressure, you'll come across the same kind of drugs that are used in heart failure as well, and in diabetes as well. But the specific drugs for diabetes, will address that when I come to that section of the talk. The other important thing is that if you do suffer from high blood pressure, they'll make sure your targets are achieved. Again, we emphasized that last week in a big way. Now, this paper is from the European Society, you see, and there are differences between the UK and the European Society, and that you need to be aware of that as well. And the one of the targets for cholesterol in the European Union is 1.4. It has to be less than 1.4 after a heart attack. In the NHS in England, it is less than 2. So it's less aggressive than the one in European style, you see. The European people are much more aggressive in making sure that your bad cholesterol is as low as we can get, you see. And if you're diabetic, again, making sure that you're well controlled as well, you see. We'll come to that in a minute. So, um, there are about 2.6 million people in England with cardiovascular disease. Yeah. And 2.1 million of them have got cholesterol related disease. That means a stroke, heart attacks, people with blood flow problems in the legs, all sorts of things like that, you see. And if we can get the target level less than 2, LD, the bad cholesterol level less than 2, the chances are that you will about 50,000 to 140,000 people will survive over the next 10 years. Now, this was published only in 2023. Yeah.
Yeah, probably.
Yeah, so it is we in England, we are not meeting the target. In June 2023, people who need statins, the number of people meeting the target is less than 30%. So remaining 70% are on the high side, you see. So that is quite worrying actually. So that's why there is a emphasis to make sure that people who take the cholesterol tablets, they're sufficiently the LDL levels are sufficiently low enough, you see. So that's the message. Okay, now this slide again published this year as well, and you can see on the x-axis on the vertical side up there the number of people who are dying from these cholesterol related diseases, and at the bottom scale this over a time period, you see, and on the top of it is the blood pressure. This is the biggest risk factor is blood pressure. Okay. And the second biggest risk factor is your diet. Yeah. So if you can control those two, get your blood pressure and your diet, then the chances are that you can reduce your risk of getting heart attacks. And surprisingly, in this particular graph that was only, as I said, published only this year, in the yellow that you can't very well see it actually, air pollution is another problem. Yeah. So if the air pollution is worse, the risk of getting a heart attack is on the high side as well. So that's quite frightening. Okay, so tablets. So once you get your heart attack, once you have had your heart attack, they will give you this kind of tablets, you see. Now there are three that I mentioned up here. You will have heard of aspirin, and many people will have heard of clopidogrel as well. And in the first year, they will probably give both of those two together, you see, either aspirin or clopidogrel, or aspirin and with this ticagrelor. So it'll be those two, you see. And you continue these two combination for 1 year after a heart attack, unless they tell you otherwise. And after 1 year, you just continue with aspirin. So it's very important that you can continue with that recommendation, you see. And the main side effects with this particular blood thinning tablets, or antiplatelets as they are called, are indigestion. And people who take the combination of clopidogrel and aspirin, um, you probably won't see in the Asian skins, or on the Afro-Caribbean skins, but on the white people, you can see quite a lot of bruises actually, and you can get quite a lot of bruises with this particular combination of tablets. But there's nothing to worry about. But it can happen. The other main serious side effect with this combination is bleeding. And bleeding can happen from anywhere. Somebody, ice cream one has turned up somewhere. The bleeding can happen from anywhere. Main likely from the stomach, and you cough up fresh blood, or from the back passage as well. Or sometimes people get nosebleeds as well. And if that is bad enough, then you unfortunately have to end up in the hospital to get that sorted. So that's the tablets, antiplatelet agents after a heart attack. Now, the other most important tablets are the statins. I've given you three up here. There are other tablets available as well, statins, but they are very, very important. Uh, and uh, sometimes nowadays, I think atorvastatin used much more commonly nowadays. Simvastatin used to be used quite a lot before, but I'm sure many people will be on it as well. And you need to continue that. And when you get your heart attack, at least in my hospital, we tend to give you atorvastatin at the maximum dose of 80 milligrams and send you home on that, along with other medication as well, you see. So you are on a pretty aggressive um, combination of statin and high dose statin, you see. So that are statins. And there are other lipid lowering agents as well, you see. And some people might have come across ezetimibe. And we tend to use that nowadays quite a lot. And these two up here are fairly new, and they are available for people who can't tolerate statin, you see. So, and this one on the top up here is an injection form, you see. So people get a injection, and the frequency will vary on the dose as well, you see. So statins, those are the statins. Those are alternative to statins, and those are very important medication after a heart attack. Now, any side effects to statins?
How
Now,
how how can we report side effects, and who should we speak to first? The pharmacist, GP, or the hospital?
well, if you've got, as I mentioned, I did mention that last week as well. The side effects, if you do get side effects, you can mention it to your GP. It's important to talk to your GP as well, because they need to keep a record of it, what kind of side effects they are, when did it happen, what they are, and is it related to the drug or not. And if it is related to the drug, they will need to think of some alternatives, and you should report it to the national body so everybody gets to know about them, you see. And there is a MHRA yellow card scheme, and if you Google it, the yellow card scheme to report side effects, it tells you what to do. And if it is a serious side effects, you should report it. And I do encourage people to report it. That's why, and that's how we, all the professional, everybody tends to learn about the side effects to medicines.
So, how often should medications be reviewed or changed?
Um, if you're tolerating very well and if you're meeting the target, that's fine. And we'll come to that in a few minutes as well. Yeah.
Okay. So, yeah, then what signs might suggest that a current treatment is no longer effective? How would you be able to tell us that it's not effective to us?
Well, it depends on well, if for heart attacks, once you've had your heart attack, the main thing, as I say, is to prevent you getting another heart attack. And if you're still getting quite a lot of chest pains and things like that, because that's how heart attack presents itself, they can give you some medication to stop that chest pain. And the other important thing with this group of drugs is that you have to take them. If you don't take them, then you will not get the benefit of it, you see. So that's the other important. If you're still having problems, then you need to go and discuss that with your GP. Failing that, and if it's quite serious problems that you're having, then unfortunately you have to go to the A&E department if it is quite serious problems.
And of course, I suppose lifestyle improvements reduces the need for medications over time.
It does. It does.
Yeah.
And again, we shall come that in type 2 diabetes in a few minutes.
Okay.
Side effects with statin, are people happy? The most important side effects that you will you will have read in the papers, headline news, and everywhere, is muscle pain. Yeah. Now, some people will get muscle pain, some people don't get muscle pains. Uh, but if the muscle pain is that severe, then you should go and see your GP and discuss that. Yeah. And so that is very, very important. But if you get side effects with statins or with the aspirin that I've mentioned or the clopidogrel, because those are two important drugs after a heart attack, if you're having problems, please go and discuss it with somebody that can help you to give you some alternatives. Just don't stop it, because if you do stop it, the risk of you getting subsequent event is quite high.
Can I
Okay.
say something about the medicines? Whenever I'm prescribed a new medicine, I get a call from the pharmacist 2 weeks later asking me how I'm getting on with it, if I'm having any side effects, if there's any questions I have about the medication.
That's very good. Yeah, that's very good. And that's
any new medicine, no matter what it's for.
good. Well, if they're giving you that kind of service, then that's very good. Excellent. Okay. Now the other thing with statins is that if you sometimes get infections, and if you're allergic to penicillin, they can give you some different kind of antibiotics, you see. And and then there can be a problem with the statin, with the antibiotic. And the antibiotic that I've got in my mind is clarithromycin. Uh, and you will, if you go to the same pharmacy, then they will be able to look at your records, and they will advise you that whilst you're taking the antibiotics, to stop the statin, and once the antibiotic is stopped, you restart your statin, you see. Because if you continue to take the specific antibiotics called clarithromycin with the statins, it can cause quite few side effects, and we want to avoid side effects. The other thing is grapefruit juice, especially with simvastatin. If you enjoy your grapefruit juice and you're taking simvastatin, then those two don't go very well together at all. So you have to change your breakfast juice. Okay. And the other aspect of a heart attack is that they should give you a spray called a GTN spray. It's quite important that you have that with you and you carry that with you. Is that just in case if you get sudden chest pains or tightness in your chest, you can use this spray. Just sit down, rest, and you can use this particular spray under your tongue, and it one spray, and see how we go, and and that will relieve your chest pains or discomfort. So you must carry that and make sure that is in date. But the need for the spray should be less and less if they've given you the right set of medication to reduce your chest pains and all that, you see. Okay. So the most important point following a heart attack is that if you're suspecting that you've got a heart attack, you need to get into the hospital as quickly as possible. The longer you sit at home, the more problems you will get, you see. So, and after heart attacks, people can get some complications, but I won't go into them here. Most of the patients recover very, very well without any problems. And as I've mentioned, statins saves lives. So unless you can't tolerate it, or you can't tolerate any statins even at a low dose, you should discuss it. Yeah, there are alternatives available. So after a heart attack, it's so important to take the statins. And as I mentioned, as soon as you get into the hospital after a heart attack, at least in my unit, we will give you 80 milligrams of atorvastatin straight away. Yeah, and then once you go home, you need to check your lipids just to make sure that you're getting into the target, you see. And as your colleague mentioned, after a heart attack, there are some services available where specialist nurses will call you to make sure how you're getting with your condition, you see, just to check on and encourage you to come to exercises as well, so you can get back to normal, you see. The need to check the blood test after 4 to 6 weeks is to make sure that you're getting to the target. And as I've already mentioned, less than 30% of the patients in the UK are not getting are achieving target, you see. So the remaining 70% are not, you see. So there's a very high number that are not getting the target.
Please explain what a lipid profile is.
So when they do a bloods, when they say they're going to do a lipids, they check for your cholesterol levels and different type of cholesterol levels in your body. That's what it is.
I
Okay.
think it's also called trisaccharol, isn't it? The bad LDL.
Well, that's it. That's the LDL is the bad one. There's the total cholesterol. There's the low density lipoprotein. There's a high density lipoprotein, and there's the other one, triglycerides. Now, some people might occasionally have seen people walking around in the supermarkets. You might have seen them, and if you observe them, they might have some yellowish patches on the top of the eyes or on their elbows. And those are cholesterol nodules that are present there, you see. So if you might have seen them, but those are quite concentrated cholesterol molecules sitting there, you see.
Mine was very high. My tricycle was very high. And obviously, this is why I was put on these injections every fortnight. It's called
Yeah.
PCSK9.
Yes, yeah. So that's one of the, well, I haven't got the picture of that, but it is, yes, yeah, PSK9, yeah.
Yeah,
You're tolerating it very well?
I am at the
Good.
moment, and it's helping me quite a
Yeah,
lot.
yeah.
Yes.
So
I
it
have a
just carry on.
I have a question. What are the likely side effects of statins?
Well, the main side effect of statin is muscle pain.
Oh,
Okay,
mm,
so those muscle pains are bearable and they're manageable. So
mhm,
that's the main concern with the side effects with
mhm.
statin. Yeah, but some people have some weird side effects as well. You see, so um,
Like,
that is now there's some you will see a list of all sorts of medicines when you get your statin prescription. They will give you a whole lots of list of medication of side effects printed on it. You see, and but what I want to say to you is that if you read that list, it doesn't mean that you will get that side effect. You see, that's the
mhm.
important. It is unlikely that you'll get all those side effects. So try it and see how you get on, how your body tolerates, you see. And sometimes when you tell people that you're getting this is the side effect, it comes into the mind, oh, I'm going to get that side effect, you see.
Mm.
All the drugs have side effects, but we have to find ways to manage it. And majority of them, we will be able to find ways of managing those side effects.
So these statins, do you have to take them throughout your life, or like blood pressure medication, or that? Well, except for the when you are taking antibiotics, of course, you stop the taking statin. But otherwise, do you have to take it
Yes,
lifetime?
yes. Simple answer is yes.
Mm-hmm.
There,
Okay.
there is a question there. Is it advisable to take low dose statins after age of 70, even if your cholesterol is normal? If you have history of stroke in your family?
Well, you will see when in order to get a statin, you will have to go and see your GP. Yeah, and the GP will do a scoring based on your family history and everything. And they say if you've got a history of a stroke, and depending what your cholesterol level is, and if your risk is greater than 10% over a 10-year period, then they will prescribe you a statin. They will offer you a statin. Yeah. It depends on your risk profile and the risk score that you get, you see, and that is all individualized.
When I had my heart attack, I was actually, well, I was on four different kind of statins, and all of them gave me side effects, and that's what hit my heart. And I was put in 5 stents, and then I was given dialysis for that, and it continued for quite a long time. After that, I started on the PCSK9 injections, and that helped me better than the dialysis, because dialysis took at least 3 days for me to recover.
Yeah,
I, I was told if anybody prescribes me statins, I must tell them I'm allergic to them.
fine. Yeah. Well, you will tell them that you're on PSK9 anyway. So that the only time we use that is that people who cannot tolerate statins, you see. So alternatives are available.
Okay, that
Okay.
understandable. Yes, thank you.
Yeah. So let's move on to talk about diabetes, type 2 diabetes in adults. Okay. Now, now the diabetes, they look at the HbA1c, your blood glucose, and if that level is above 48 or 48 and above, then that's the new nomenclature. There's a new way of monitoring diabetes. The other way is, again, HbA1c, but looking at the percentage, 6.5 and above, then you're classed as type 2 diabetic, you see. So that's how they diagnose diabetes. And the main aim of treating diabetes are twofold, or they are threefold actually. One is to control your blood glucose very tightly as much as we can, and that is to reduce your complication in your eyes, in your kidneys, and in your nerves. Yeah. So with the eyes, it's called retinopathy, and kidneys is diabetic kidney disease and neuropathy, where you lose the sensation in your legs and your arms and things like, mainly in the legs. And the HbA1c tends to give you a blood glucose reading over the period 2 to 3 months in the past, you see. And this level up here will be your how how low this level should be will be discussed between yourselves and by your GP or your diabetic team. So that is one thing that we want to do to control your blood glucose. But the other important thing, a main problem in type 2 diabetes is people die because of cardiovascular problems. Yeah, like high blood pressure, heart attacks, strokes, and things like that, you see. That's what they die of. So we need to prevent that, you see. We need to reduce that. And the other thing that we need to do, if you're taking medication to lower your blood glucose, you want to avoid your blood glucose going very low as well. So that is called hypoglycemia. So three things we are trying to do is to control your blood glucose very, very tightly, to reduce your cardiac mortality, and to avoid your blood glucose going very low as well. Yeah. And and the other thing that obesity as well comes into diabetes, type 2 diabetes in a big way. And we need to control that as well, you see, as much as we can. Because as I mentioned this last week as well, it can cause high blood pressure, high cholesterol levels, and type 2 diabetes as well.
He's got sleep apnea there.
Now, diabetes in UK, there are nearly 5 million people currently with type 2 with diabetes. And every week in UK,
Wow.
about 190 amputations are amputated, 770 strokes happen, 590 heart attacks, and heart
Wow.
failure. So you can see the scale up here is very, very high. You see the people who have got type 2 diabetes, the complications they can have is quite high, you see. Yeah, so you can see that. And and the other important thing is to check your feet as well, you see, to make sure that your feet, you get your feet are not becoming numb, you get sensations, and you need to get that checked out as well. It's very, very important to check your feet and to check your kidneys as well. Every year you need to get this checked out, you see. Unfortunately, that does not happen. Yeah, so it's very, very important to get that. Now with eyes, I think there is a diabetic scheme that people with diabetes, their eyes are tested quite regularly, you see. So there is a system there established. So NICE, which is a very important body in the UK, tells us how we should be looking after this condition. And as I mentioned, your HbA1c target will be individualized. It will be agreed between yourselves and your team that's looking after you for your diabetes. And then this is new, actually. This was published in 2022. Rather than just looking at your diabetes to see how well your blood glucose is, now they're looking at your cardiovascular risk as well, and to look at your cardiovascular risk, to look at your kidney function as well, to make sure that we tackle all those things as well together, rather than just looking at the blood glucose, you see. So if your cardiovascular risk is quite high, then you will be managed in a different way, you see. So that's the message from the NICE people. There's a European society as well to say the same thing. Uh, if you have got no cardiovascular disease, you've had no stroke or a heart attack, but you've got type 2 diabetes, then it is quite simple. They can give you a simple drug called metformin to help you with your diabetes. But if you have had high blood pressure, or if you have had the kidney problems, if you've got eye problems with your diabetes, then the agents that will be used will be slightly different. We'll talk about that in a few minutes, you see. Okay. So it depends not only on your blood glucose, but depends on your cardiovascular risk as well. So both are taken together. And again, it's so important. Lifestyle factors again comes into type 2 diabetes in a big way. And the reason why we're getting type 2 diabetes is because we are lazy, we don't do any activities, we sit around, we get fast food takeaways, we don't do enough exercises, we smoke, our food intake is all sorts of rubbish. So that collectively over the few years is causing us some problems. And if you lose weight after a diagnosis of type 2, there is a chance that you will lose there's a chance that you will get type 2, remission of type 2 diabetes, meaning that you will not, if you lose weight sufficiently and do all this good work, then you can get rid of your type 2 diabetes. So there is evidence for that as well, you see now. And sometimes you don't need medication at all. You can control your type 2 diabetes with diet alone, and the dietitians can help you with that, making sure that you reduce your carbohydrate intake quite significantly. So that's important. But I think you're having a talk about nutrition next week, I think. Okay, now let's talk about the medicines for type 2 diabetes. Again, statins come into it. Uh, Statins are so vitally important in the management of type 2 diabetes. And depending on your risk factors, your target as to how low your cholesterol should be will be identified to you by your GP, and will be managed accordingly. But
Eyes are closed, but I'm listening.
yeah, so you should be on a statin if you've got type 2 diabetes, and they should tell you what your target cholesterol LDL level should be, you see. So you should be aiming, and you should be making sure that you're getting to that particular target. Now, these drugs for diabetes work from the brain along and downwards, you see. So quite a lot of the new drugs that we are currently using, that's been in the news quite a lot, the obesity drugs, they work in the brain, and they also work in the stomach. Yeah. The another newer tablet, which we'll talk about in a minute, they work in the kidneys. So make sure that you pass quite a lot of glucose through the urine. The other treatments work on the muscles. Um, they all work differently in the body, you see. So they will, but it doesn't matter from your point of view where they work, as long as they work for you and the choice is right. So the first one that they will go for is the metformin. Yeah. Uh, is the metformin. And the main problem with metformin, when you start it, you have to build it up slowly, because otherwise it causes quite significant nausea. People feel sick with it quite a lot, and on a long-term basis can cause vitamin B deficiency. So they will check out for that as well. But those are two main problem side effects with that. But that is, many type 2 diabetic patients will be on this metformin. Yeah.
Your metformin says brown. Is that the color you're talking about? Because it's
No, this
brown
is
and
just
the company name.
it's a company name or company logo
Okay.
and things like that. So don't worry, it's the drug that is the problem.
Yeah.
Okay. And then tablets that lower the glucose are the glycoside. I'm sure many people with type 2 diabetes could be on one of them. And the main problem up here is that it can lower your blood glucose too much, and you can put weight on, you see, with it. So glycoside, and the dose can be can be very high as well. They can start with 40, can go up to 320 milligrams, can go quite wide. So it will be depending on how well your diabetes control is. The other one that can be used for diabetes is pioglitazone. And the main issue with it is, again, it can cause weight gain, water can build up, and can cause heart failure. The other groups are the gliptins, one of them. They're very well tolerated. They're quite widely used now in type 2 diabetes. And you don't normally get weight gain with this one, you see. So that is quite good. And these are the newer drug, the ones that are in the news quite a lot. Those old people who are very rich, they can go and buy them, but they can be used in the management of diabetes, you see, semaglutide and tirzepatide, and they can cause quite severe side effects as well, you see. Nausea, heartburn, constipation, pancreatitis is quite a serious problem. You can lose hair as well, you see. So, and those are injections that are given, you see, and you build the dose up quite gradually over a period of time. And so that is quite new, and they also work to protect your cardiovascular system. And these are also fairly new. Uh, they've been around for about 15 years now. They were originally developed for type 2 diabetes, but they can be used for heart failure and chronic kidney disease as well, you see. And you can get one of them as well. And they're very well, they should be used quite a lot, and they prevent cardiovascular problems, mainly heart failure and you ending up on the dialysis unit. So the main side effects with this one is the bladder. You can get bladder and urinary infection, you see, because the reason why you get that, the way they work is to pass quite you pass quite a lot of glucose or your sugars in your urine, and if you don't keep your genitals clean, the risk of infection is extremely high, you see. So that is one of the risk factors for that particular drug. Okay. Now, this particular drug, as well as I mentioned, can be used for chronic kidney disease, diabetic chronic kidney disease. And the advantage of them is that for patients who have got type 2 diabetes and the chronic kidney disease, the kidneys slowly shut down, you see. Yeah. And over a period of time, they can end up on the dialysis unit. So that they tend to give you type 2 diabetic patient with chronic severe kidney disease, they tend to give you something called ramipril or candesartan, and that will slow your kidney, that will improve your kidney function, you say. But if you get this newer drug, yeah, if you get this newer drug, it will delay you getting into the dialysis unit by 15 years, you see. So that's what is estimated to do, you see. Um, you probably don't end up on the dialysis unit. So that's one of the biggest advantages of this drug in type 2 kidney disease, you see. And then, of course, in the management of diabetes is insulins as well. So if those oral drugs don't control your blood glucose, your HbA1c is still on the high side, then they can add in insulins. Now, there's several type of insulins, and then I'm not going to go on it. There are so many of them. So, but you just have to be aware of which insulin you're on it, and just make sure you get the right one all the time. Okay, and for type 2, there's some informations out there. This is the trend diabetes, and it tells you what to do, type 2 diabetes, when you're ill. Uh, and if you're getting hypoglycemia, it tells you what kind of symptoms you can get. And if you're fasting, and it'll give you some guidance about fasting as well, you see. So there are quite a lot of guidance there on the web about type 2 diabetes. So any questions there? It's quite a
I
lot
would
of
like to
information.
I would like to ask, how exactly do diabetes medications help lower blood sugar levels in the body?
Well, this one, This one, what this does is to actually actively promote all the glucose that's in your body. It gets removed through it's through the kidneys into the urine out. You see, that's how it tends to reduce your blood glucose. You see, and they're very very effective. And with this uh, um, dapagliflozin or empagliflozin or canagliflozin, you tend to lose quite a lot of weight as well, about two kilograms, and because you lose weight, your blood pressure also drops. You see, so that's how these tend to work. You see. So this is they work in a different way, you see, in the body, and some drugs like metformin that work on the muscles to make sure that the glucose is used up by the muscles. They work all in a different way, and some drugs from the gut are prevented. The glucose is prevented from being absorbed as well. You see, so they work in a different way. The newer ones, they affect your brain, so you don't feel all that much hungry, and if you don't feel hungry, you don't feel like eating. So that's how you control your blood glucose that way. So they work in a all different ways. You see.
I've been on glycoside for many, many years now. I don't find any different.
Fine, as long as your HbA1c is good, well controlled, that's what it needs to be.
Okay.
I,
Okay.
I have sent a question on the chat that I'm diabetic and a BP. I've been offered statin tablets for past 12 months, but I have refused it because I haven't got any cholesterol. So they keep on saying that you'll be at risk in future, but my cholesterol's always remained low.
Well, it is because they will have done have you got a family history and all those, they will have taken that into account, and they will have offered that particular um, there will be a reason as to why they've offered it. Yeah, because the risk, if there is a greater than 10% risk of you getting a heart attack or a stroke, that's why they're giving it is to prevent you getting that particular problem, you see.
Nobody in the family's got a heart attack. My father was diabetic, so was my brother.
Yeah.
But mum's side, nobody. So I've never had cholesterol for all these years. I'm
Yeah,
not
but
75 plus,
yeah,
But
it
they've been
doesn't.
offering me every
Well,
past 12 months,
they have to offer you. They'll have looked at your risk, and it is your own personal decision whether you want to take it or not. From our point of view, from the healthcare point of view, there is a risk for you, and they have uh, they have offered you the treatment. It's up to you whether you want to take it.
I know. It's just like extra tablets in the stomach,
I know it's an extra
metformin,
tablet, but
glycoside,
we as Asians and Afro-Caribbeans, we are at a much higher risk of getting these particular problems.
Eric, I'll have to think about it. Thank you.
Yes, yeah.
So, what do heart failure's medications do to support the heart's functions?
The the way they work in the heart are slightly different. Because in the heart failure, the stresses on the heart are quite high, and we need to reduce that stress levels quite in a big way. And these drugs work to reduce that particular stress level, you see. So that is one way of thinking, and the other way of thinking is that especially the drugs like SGL2, we just don't know how they work, but they still work. And the evidence suggests they reduce the problems for patients who have got heart failure. So we're still trying to learn exactly how they work.
Okay, there's a question in the chat. I'm diabetic and have BP. They've offered statins, but don't have any cholesterol. Oh, that's the lady.
That's me. I've just
Yes.
asked it. Thank you.
Yes.
Thank you.
Well, but
Thank
it
you.
depends what your cholesterol is, you see. So when you say you don't have any cholesterol, what you
It
have
was under 3. It was under 3 all this while. Not had
Okay.
it, no cholesterol this years, yeah.
Okay.
And been diabetic for good over 16 years now.
Okay.
And BP started only last 2-3 years
Yeah,
ago
yeah,
only.
yeah,
Didn't have
yeah.
no BP either. But just started on tablets past 3 years now.
Okay, for your blood pressure.
Uh-huh.
Yeah, good.
So it's just like I just didn't wanted to take any cholesterol tablets, but they are the statins, So I'm thinking, why am I taking it? Have I got it,
Well,
But like you said, it's a risk, isn't it?
it's a risk, and
It's a risk.
and when you get a stroke, well, there
I
you go.
know.
You're
That's
Thank
very
you.
brave
prevent.
and wise.
Yeah.
Thank you.
Okay.
I don't blame you. Don't take them if you don't need them.
Yeah, we're just pumping so many medication, isn't it?
It is. It is.
Yeah.
I'm. You will not believe I'm on 20 tablets a day, and it's
Yeah.
ridiculous. It's like intake of food instead of a proper food.
Medication, yeah,
Well,
loads of medication,
that's the
yeah.
whole point.
Yeah.
We need to look after our lifestyles too, so that you don't need the medicines.
Even
Well,
after
I've
eating good
changed.
food,
Yes, I have changed quite a lot of my lifestyle as well.
Yeah.
But now,
Now,
how do medications for chest pains help prevent future heart attacks or complications?
now it depends on your the drugs that when they have chest pains, that will be angina, you say, and if you're treating the angina, and if you treat the angina very well, and if you're still getting angina, they will do what do a scan of
ECG.
your they'll do a scan of your heart of the coronary angiograms to see where there's any blockages or anything like that, and they can offer you stents as well if you're getting angina. Some people who are stable who don't have heart attacks, full-blown heart attacks, but they're getting angina, they can still do a coronary angiograms and look at your coronary system, and they can decide what they can do. And in type 2 diabetes, the blood, the coronary arteries around the heart are quite narrow all the way, you say, not in just one or two distinct places. When they're in narrow, distinct places, that's where they can put a stent in. If they are narrowing quite in a wide areas on a long path of the arteries, then they tend to prefer you to go for a bypass surgery, you see. So they can look at the coronary systems and assess you in that way.
Okay, there's a question on the chat. Why do you get heart failure? What are the causes?
Well, the causes of heart failure are many actually. Sometimes very high blood pressure, extremely high blood pressure. So if you if you look at if you take a wide bore tube, yeah, and if you want to put a liquid, pass through liquid, it will be quite easy to pass through it because it's wide bore. And if you put a narrow bore tube passing the same amount of liquid, it'll be pretty hard. And that's what the heart has to do, you see. And the heart has to work against high blood pressure. And high blood pressure is the one single most commonest problem with heart failure. That's one. And the other one is heart attacks. When you've had heart attacks, that's the ischemic heart disease. So that's the other cause of heart failure. The other causes are genetics. The other causes are the valves are not working very well either, you see. So there are a number of causes, but the two most important ones are blood pressure and ischemic heart disease, that is angina and all that. And the other one is now probably coming up to is obesity and type 2 diabetes as well.
I think you mentioned the medications. My question was, are there any medications that help improve blood flow or oxygen to the heart? I think you did mention that, didn't you?
Yeah, yeah. But the main thing is to get your coronary system angiograms, and that's the only way that's going to sort it out. Yeah, to get your coronary system looked into, you see. Okay, so the heart attacks, where am I now? My screen is totally different now.
No, yeah, your screen is off, so you got to switch it on again. You got to share.
Is it? I thought I was sharing it.
I have a question. Um, what is angina? Can you please explain what is angina?
Yeah, that's a good question. The angina is when the blood supply to the heart muscles is getting less and less, and you're trying to do, say, if you're climbing up the stairs, and you get chest pains as you're going along. So because you're working hard to go there, the blood flow to the heart is not sufficient. So it's quite a lot of narrowing happening in your coronary arteries. So there's not sufficient blood flow going, you see.
Mhm.
Yeah.
Okay.
Okay.
And it's an angiogram that they take, isn't it?
That's the angiogram that you need. Yes. Okay. Let's go on to heart failure. Is that okay?
Yeah.
Yes, thank you.
Can you see my slide now? Heart failure.
Yes.
Do you still want me to continue?
If
Yeah,
anybody has objection, I don't know.
I'll continue. Okay, heart failure. So here, the main thing with symptoms of heart failure are short of breath, physical activity is reduced, you get quite tired, fatigued, your legs swell up quite a lot, and you're unable to sleep without several pillows. You see, become quite breathless. You're gasping for some breath at whilst you're sleeping as well. You see, so this tends to build up over a period of time, and you get quite tired. You just don't have any energy. You see, and you can see you're getting short of breath. The and your legs are building up, getting wider and wider, and sometimes the water also accumulates around your belly as well. So those are the things that you're looking out for, you see. And as I've mentioned, high blood pressure, ischemic heart disease, which is angina, heart attacks, and all those things can cause heart failure, you see. Now, these are the figures from the British Heart Foundation 2020. So if you look at this, there are about 200,000 diagnoses of heart failure in the UK every year. Yeah, 200,000 heart failure attacks every year. Now, most of these, 8 out of 10, are diagnosed when they arrive in the emergency department. 8 out of 10. Yeah, 80% of them are diagnosed whilst they end up in the emergency department. The reason why they end up in the emergency department is because they can't, completely short of breath. The legs are so swollen up, the belly is so swollen up or something like that, and they can't, they've got no energy at all. Yeah, so that's where they end up, you see. But 4 out of these patients will have had symptoms. They've been seeing seeing their GPs for advice and things like that. 4 out of 10 will be seeing their GPs, but the diagnosis has not been made. But as I say, a majority of the time, the diagnosis is made when you end up in the A&E department. So there are different types of heart failure. So what heart failure is that when the blood goes into your left side of the heart, it then gets pumped out, you see. And the amount that is pumped out that's what is measured. And the one that I'm going to talk about is the amount that is pumped out, which is less than 40%. And that is called heart failure with reduced ejection fraction. Yeah, so only about less than 40% of your blood that goes into your heart is pumped out. Yeah, you can get heart failure with say, with more than 50% of is pumped out. That is called heart failure with preserved ejection fraction. But I'm not going to talk about that. My emphasis today is to talk about heart failure with the amount of blood that has been pumped out by your heart is less than 40%. So that is heart failure with reduced ejection fraction. So the main thing with what happens in the hospital, because you have built up all this water in your body over a period of time, we need to get rid of that water. The only way we are going to get rid of that water is to give you some diuretics, some tablets, water tablets, and mainly it will be this middle one called furosemide. That will be given as an injection, and we'll continue to give that. The amount of how much you get will depend how well you respond. You see, yeah. And if you have got heart failure, and you've got this kind of degree of heart failure, then the chances are that you will end up staying in the hospital. The average length of stay is about 11 days. So during the hospital, they will monitor you quite closely for all sorts of things. May try to keep a record of your weight to make sure how much you're drinking and how much you're passing out urine, you see. And they'll give you this the water, the injections to remove your water out of you. That will depend. They will also check out for your iron, whether you're anemic or not, you see. That's so important nowadays because probably about 60% of the patients with heart failure are anemic, you see. And if you are found to be anemic, then the chances are that you'll be given intravenous iron in the form of an injection in your body once. The oral tablets don't work. Yeah. And then we will start to introduce some tablets into you, four different type of tablets. And the reason we want to introduce these four different type of tablets into you is to prolong your life and to avoid getting readmitted into the hospital. So is for you to have your life, enjoy your life with your family or whatever you want to do, and to not get into the hospital again with heart failure problems. So that's the reason. So I've already mentioned these drugs, the heart failure drugs, the dapagliflozin, uh, empagliflozin, and kana. These are the drugs that are used for heart failure. And I've already mentioned the main side effects. They are also used for type 2 diabetes, and they're also used for chronic kidney disease as well. The other drugs that help, again, along with this one, they work in a different way, is the spironolactones of this world. And the main problem up here is that it can build up too much potassium in your body. So you have to be regularly monitored for a regular blood test whilst you're on this. And if you're a male, if you're on a high dose, we don't use that high dose, but not in heart failure. But if you've got liver disease, then you can get breast enlargements, you see. And then we mentioned this particular group of drugs in our talk last week about blood pressure. So they can use one of these group of drugs as well, the ACE inhibitors or the candesartans. And the main side effects are cough, angioedema, and renal impairment, and high potassium as well. So again, when they start this medication, your blood has to be regularly monitored, making sure that you're not running into problems and your blood pressure is fine as well. And if your blood pressure in the hospital is very good, in my experience with heart failure patients, that's not the case. But if it's very good, then we would start this medication, sacubitril with valsartan called Entresto, and that is good. And then the other one is a beta blocker. Yeah, so one of those beta blockers will be used, and we start slowly and build the dose up again. And the main problem with beta blockers is that they get low pulse and low blood pressure. And in males they get fatigue as well, you see. So in males they can get erectile dysfunction on a long-term basis as well. Okay. And if you've got heart failure, then I would suggest that you don't take this kind of drugs at all, ibuprofen, which you can buy from the shops, and naproxen, which a GP can prescribe. But if you've got high blood pressure or heart failure, I suggest you don't buy them at all, and don't use them at all if you can avoid it. And I mentioned this last week as well, these fizzy tablets, because they contain too many sodiums, too much sodium. So don't use them. Just use the plain paracetamol or the cocodamol. It's the fizziness that's the problem, you see. So in an ideal patient with heart failure with reduced ejection fraction, you should be on these four drugs: a beta blocker, Entresto, spironolactone, or one of these drugs, dapagliflozin or empagliflozin. That's what you should be on. There has to be a very, very good reason as to why you are not on these 4 drugs. Yeah. There has to be very good, because these 4 drugs saves lives and it prevents you getting readmitted into hospital, you see. And you could be also or may not be on the water tablet depending on your conditions. So after you've been let loose from the hospital, you will be followed up by your community heart failure nurses, teams that would include nursing, and sometimes they would include pharmacists as well. And they will check out for your bloods to make sure you're tolerating these medicines, and also making sure that you are on the right dose as well, as much as you can tolerate as well, you see. So that's so important in heart failure patients. So any questions on that one? If there's no question, I just want to say a few final things. Now, if you are ill if we all get ill, sometimes we become quite sick, or we've got a bout of diarrhea, or we can't keep our food down, and then if that's the case, and if you're taking one of those medicines that I've mentioned, the ACE inhibitors, the ibuprofens of this world, or diuretics, or certain tablets for your diabetes like metformin or the dapagliflozin, then you should temporarily stop them, you see, when you're feeling sick or you've got quite a lot of diarrhea and you've got dehydration, you see. So when you're quite ill and you've got these kind of conditions, then you should stop it for a day or two. And then once you're better, eating well and drinking, and you feeling better, restart those tablets. It's important that you restart those tablets. And the reason why we are saying that you should temporarily stop them is to prevent you running into problems with your kidneys and your blood pressure, you see. So that's the reason. Yeah. Now, all these medicines that I've mentioned, the beta blockers with the Nature's Health, they were identified from a Brazilian snake, just for your information. The newer drugs, the SGL2, the empagliflozin, they came from the bark of the apple tree, and the statins, they were discovered from the fungus in Japan. So again, this important nature does help us to find these important drugs as well, you see. And the other final thing in my presentation is this cardiovascular disease in England. And again, they published it only yesterday evening about prevention. The main to say is that cardiovascular disease in the UK, 1 in 4 of every death is caused by cardiovascular disease. And the second paragraph up here is cardiovascular disease is largely preventable. Yeah, so you can prevent it. Thank you very much. I'll stop there.
Thank you very much as well. Is it helpful to keep a medication diary, and what should be noted in it?
You should, if you can keep it, you've got the phones. The phone, one of the advantages of having a phone is you can keep quite a lot of information there. So I would keep it there, and when you started this medication, why you stopped it, what dose you're on it.
Very advisable, I think. Yes.
Yeah.
Well, it has
I have a question.
Yes, Mayuri.
Is it normal to feel dizzy while you are on blood pressure medication?
Yes.
Dizzy at times.
Well, you shouldn't feel dizzy, but if you're feeling dizzy all the time and you're holding on to things and you're feeling dizzy, then you need to get yourself checked out. They may be able to adjust your blood pressure tablets to lower it slightly, so that they can do that. Or you can take those tablets at night, as long as you don't get up at night for a wee, you see.
Oh, okay. So they can lower the dose of the
Yeah, they need to say,
medication.
if you're feeling dizzy, that is called symptomatic low blood pressure, then you need to get it checked out.
Okay.
Can I ask a question? Quick one.
Yeah.
Yes.
Okay, just that I'm on Ramipil. They have given me 1.25 milligram, but I just feeling so uncomfortable taking that medication.
When you say uncomfortable, what do you mean?
I just feel like a short of breath every time, and I just feel as if I'm not feeling that great because I've got 50% one of the artery narrowed, so they can't put stent in. They have given me statin as well as ramipril as well,
Yeah.
and iso whatever that
Isosorbide mononitrate.
Yeah, isosorbide, yeah.
Yeah.
So, but ramipril they have prescribed me, but I just feel so like short of breath all the time. Just don't feel comfortable.
Why don't you go and see your GP and say they can consider a different one or a different, or they can consider a one of the other group of drugs.
Okay, because I did tell them in a hospital while I was there that I'm not feeling very comfortable with it. Because as soon as I started taking I took it there for 4 days and I just didn't feel right, it's just short of breath. So I did tell GP, but he says, no, you have to protect your heart. So that's why he just gave
Yeah, but
me.
they can give you an alternative one. There are alternative drugs available, so they can try that as well.
Okay, all right. Thank you. I will do that.
Yeah.
Okay, thank you. Okay.
Okay, I think it's time for me to say thank you so much, everyone, for joining us today. And a special thank you to Mr. Uttam Chauhan for sharing his time, knowledge, and deep insights over his helpful series. So, over these 3 sessions, we've had gained quite a lot of understanding and explored how these medications work. And also today, we covered possible side effects. So, that is quite a good thing we learned. Health isn't just about taking medicines, it's about understanding and feeling confident and being empowered to take charge of your own care. So, we hope this series helped you quite a lot. Thank you very much, Uttambai, and
Thank you
thank
very
you,
much.
everybody.
Anna,
Yes,
don't
Doris.
forget that he promised to have a one-to-one with me about alternative medication for amlodipine.
Okay, Uttambai, you promised her.
Yes, yeah.
I'll wait.
Shall I
Well,
share your phone number to
yes, yeah,
Mr. Uttambai?
yeah.
Oh,
You
okay, fine.
can ring me.
Yes,
Okay,
Okay.
okay, Doris, I'll share it with him.
thank you.
Thank you very much, everybody. Have a lovely
Thank you.
evening. Sorry, we've
Thank
taken
you.
15 minutes of your time, 20 minutes of your time, and I apologize again, sincerely. So, same time next week, and the subject is different. So, let's carry on and catch you up. Look out for the link. Thank
Thank
you
you.
again.
Is it
Yes,
every
thank you.
week?
Thank you.
Or
Thank
is it
you.
every week?
It's every Thursday, same timing, 6:30 till 7:30.
With same
Unless the
Zoom?
topic.
Same
Sorry.
Zoom. Same Zoom. Yeah.
Same ID, same password, everything same, except the title will be different.
Of course, yeah.
Thank you.
Thank
Thank
you.
you, thank you, yeah.
Thank you.
Okay,
Take care.
namaste.
Bye.
Thank you.
Bye-bye.
Namaste,
Bye.
everybody. Good night.
Namaste. Bye, bye, bye. Thank you.
Shubharatri.
Bye.
Bye, everyone.